We're live. Hi, everybody. Welcome. Good evening. I'm Dr. Lisa Merritt, Executive Director of the Multicultural Health Institute, and I have the distinct pleasure of welcoming everyone to our healing circle as we celebrate pink for October. I didn't really have anything pink. This was pinkish, and it was a dress, which is not scrubs. So, as we know, this is Breast Cancer Awareness Month. And I'm so pleased to have my dear colleague and comrade, Dr. Addae, who is the president of the Gulf Coast Medical Society that we're all members of, which is the local branch of the National Medical Association. We're going to give a little more time for our guests to arrive. And in the meantime, I would also like to introduce our wonderful VISTA volunteers. We have Mia Grisales and we have Monique McLeod. And we are really pleased this is their first effort with MHI to do a healing circle together. And we want to definitely thank them. And we're looking forward to the added pizzazz they're going to bring to this process, even some workshops and other ideas that they have. Because we all know the importance of bringing truth and verifiable truth from trusted resources for the community. And we also know from our work on many realms, from HIV to COVID to diabetes, all kinds of health conditions that we have dealt with, dealing with the rates in which they occur in different populations varying, that people like faces and like places. And so we're very pleased to have Dr. Addae. And if I could now see his bio, Mia, I would like to introduce him formally.
Yes, I just emailed it to you. Do you want me to share it on the screen?
Yeah, if you could share it on the screen so everyone can read together who wants to see it, and it's also part. And we will be recording this, so those who are on the call with us are implicitly agreeing to being recorded. And it will also be part of a YouTube projection for those who are not able to catch it right now. You'll be able to catch it later and share with your friends. Okay? So Dr. Addae is affiliated with Sarasota Memorial Hospital, and he has earned high praise from patients for his compassionate bedside manner and clear explanations of care. He's been honored with roles such as the Dean's Outstanding Student at USF and serves as a clinical assistant professor. He is trained as a specialist in obstetrics and gynecology with a specialization in high-risk OB. So we know that that's one of our concerns is the increased risk of maternal mortality, morbidity, and sicknesses, especially amongst women of color. So we're very pleased, and MHI has relied on Dr. Hill and Dr. Addae, and I see Dr. Hill is joining us too, to have them in our community. It's such an honor and a pleasure. So as we go into today's session, we're excited to hear from someone who brings with a deep clinical expertise and genuine care for women's health. And please join us all in welcoming Dr. Addae. Thank you so much. And could everyone please mute until we get to the Q&A part, in which we will be able to answer questions. If you want to put questions in the chat or post on the Facebook, we'll pick those up and get to those at the end of the talk. Thanks. Okay, so Dr. Addae, do you want to share screen and pull your slides up? Are you having any difficulty? While he's working on that, I want to invite Dr. Hill. Thank you for joining us, Dr. Hill. And I want to point out that Dr. Hill does a regular article in the Tempo News. And what was your last topic, Dr. Hill?
The one that will be in this week will be on the breast event that the Lynx are having at Dillard's in terms of bra exchange, not exchange, well, really exchange. Those who have bras they're not using can bring those because they can go to the underserved women through the Women's Resource Center. And then there'll be a discussion and some comments about breast cancer by Kathy, who's one of our nurse practitioners, Kathy Jenkins. So this is breast, as you know, as we all know, this is Breast Awareness Month, and we're doing everything we can to remind women about the importance of getting that first mammogram. There actually was a study out this week that showed that women who get their first mammogram early are more likely to continue to get them for the rest of their life. So this is important that we teach our women, teach our young girls importance of their own self-breast examination, and then when the time comes to get their mammogram. So we talked a little bit about that in the article this week.
Thank you. And so we'll hear some more from Dr. Addae about overall women's health and breast health. And we're also looking forward to the MHI and Community Health Fair on November 1st at Angie's leading. So we have a lot of good things coming. So Dr. Addae, I know we appreciate you being in between catching babies and other things. We're going to catch you. Do you have your slides? Are you able to link them
Yeah.
in?
Yep. Thank you, Dr. Merritt and the MHI crew for what you do for the community. We appreciate what you do, and we want to support you in every way possible. Let me know if you guys can see my slides.
Yep.
Yes.
Okay, wonderful. So, I'm going to spend a short time to talk a little bit about breast cancer, the incidents, what's going on in the country. I have special interest in the prevention aspect of it and special types of breast cancer unique to women of color and some myths about breast cancer. So just keep your, I'm going to be open for questions. I just went out there to tell somebody that I want them to hold on for me to do this presentation. So I'm not going to be any rush to do, right? So as most of you people are aware, breast cancer is the most common most common cancer in women in the US. Indeed, 1 in 8 women will be diagnosed with breast cancer at some point in their lifetime. Now, we have made some strides, from 1969 to 2015, we gradually decreased the rate of death from breast cancer almost like 40%. And this is completely due to early detection and treatment modalities that we are available now. If you want to put it in perspective in terms of our time, every 2 minutes, a woman in the US is diagnosed with breast cancer. So it's a very serious thing going on. Every 29 seconds, we diagnose breast cancer here. And the leading cause of cancer death after lung cancer. And because it occurs a lot of time on people who have actually been taking care of themselves, and they may not have a very significant and unhealthy lifestyles, it affects everybody and in this country. So these are the statistics as it stands now from the American Cancer Society. As I said, 1 in 8 women will be diagnosed of breast cancer in their life. And about 1 in 40 would die from breast cancer. We are making strides, but the strides are not being evenly distributed. That means that not all sectors of the population are benefiting from the treatments that we have. So in this year, there's going to be over 300,000 newly diagnosed invasive breast cancers and about 70 or 60,000 non-invasive breast cancers diagnosed in this country. And unfortunately, over 42,000 women die. In Florida here, it's projected that about 23,000 women are expected to have breast cancer in the States this year. In last year, about 3,160 women died, unfortunately, of breast cancer in Florida here. 93 in Sarasota County and 66 in our own Manatee County. So this is a big deal. And like most diseases, when you look at how are we going to prevent it, how are we going to diagnose it, and how are we going to treat it, the first thing we normally look at is primary prevention. Is there a way that we can prevent this disease? And as it stands now, we don't have anything to prevent breast cancer yet. A lot of research is going on, but we don't have any vaccine. We don't have any shot that we can give. And so the next level of treatment that we need to look for is what is called secondary prevention. That means early detection. Is there a modality to screen people to detect the disease earlier so that we can manage it so that people don't die from it. And that's where breast cancer, we have been successful in identifying areas where we can screen. The advent of the mammogram has been a game changer. However, not everybody have access to these screening tools. As you can see, if you look at the state, the country, the US, the incidence is actually higher in white women than our people of color, African American women. However, the American woman is 40% more likely to die from the breast cancer than a white woman. And why is that? It all come back to early detection and access to these screening tools, right? So that's what we are going to focus now. So breast cancer and the Black woman, we have lower age of being diagnosed with breast cancer. So 60 versus 62. So the mortality rate, the chance that we will die from breast cancer is 40% higher than the average white woman. We look at the 5-year survival rate. We have the lowest 5-year survival rate compared to any of the other races. And there's one particular breast cancer, which is called triple negative. I will mention about it at some point. We have a higher rate in our people. It's 1 in 5. And it's very harder to treat. Most of the time when we diagnose it, is very difficult to actually manage, right? So these are the racial disparities in mortality. Non-white women, non-Hispanic Black, you can see that we are at 29%. And once again, there are various reasons, but the main reason is early detection. We don't get access to the healthcare system quick enough. By the time we get in there, it's probably advanced stage. The typical Black woman's breast is a little bit dense, and so sometimes the mammogram does not work and need further testing, and those barriers prevent those testings to be done. And also, we have higher incidence of the triple negative, which are the targets that we use for chemotherapy. And when it's negative, we don't have a lot of resources to treat them. There are a lot of research going on about immunotherapy and other stuff, but they have not been widespread use. And almost all the time, you need some form of insurance to be able to have access to them, right? So do men have breast cancer? The answer is yes. It's rare, but about over 500 people, men, died of breast cancer last year. And indeed, there's a story of Matthew Knowles, which is Beyonce's dad. He passed from breast cancer, right? And the incidence rate is overall low, but it has a higher mortality. And the main reason is that it's diagnosed late. And yes, we train men also to do self-breast exam, especially around the nipples when they think that something is not right. And sometimes we do the mammogram on them too. So when you look at the men, the mortality, you can see that in the US it's like 1.3 in 100,000, but in Black men, it's about 1.9. And the mortality, as you can see, is higher than every other racial group. Instead of 0.3 in other racial groups, for we, it's like about 0.5, which is about 40%, similar 40% higher than the average other race male, right? So what are the risk factors? So we divide the risk factors into things that you cannot change and some things that you can do something about it. So these are risk factors that you will not be able to change because it's based on either your genes or your age. So the older you get, the more likely that breast cancer will be diagnosed in you. So the incidence is higher in older men and older women. And that's why when we do when we present the data, we actually always have to adjust to reflect age adjustment, because if you have a county that has more older women there than another county, obviously, by the nature of the disease, we are going to have more breast cancer cases. There's genetic mutation, which is strongly associated with breast cancer. We call it the BRCA1 and BRCA2 genes, and they are associated with both breast cancer and an ovarian cancer. And this is one of the things that we can screen genetically and diagnose people, especially those with family history of breast cancer. The reproductive history is very, very important. The extent at which your body is exposed to the regular regular estrogen. So the time that if you get into menarche, you have your period early and you go into menopause late. That is the lifespan, how much you are exposed to the undulating amount of estrogen. It affects how likely you are going to get breast cancer. However, if that's
Could you explain menarche, Dr. Addae, please?
Yeah. So
Just
menarche is the
explain
first
what
age
is that?
that a woman, the first age that a woman has their period. So when the girls have their period, that first period, that is the age of menarche. And then the menopause, when you go over 1 year without a period, that's the diagnosis of menopause. And so that span, technically that's when you have your reproductive lifespan. That's that age period. And however, if that period at that time you were pregnant, or you had a full-term baby, or you breastfed, indeed, your chance of getting the breast cancer actually goes down. It's kind of one of the paradoxes around there. So during those times, you are exposed to a lot of estrogen, but it turns up into beneficial estrogen, right? Also, if people have dense breast tissue. Now, this is not the main problem that the dense breast present, is that it's late to diagnose. And so it's almost always in advanced stage when we diagnose it, right? There are some cancers that are associated with breast cancer. So some people who have ovarian cancer, for instance, may have increased rates of breast cancer. And there are some breast lumps, what we call the fibrocystic breast disease. Sometimes if you have a multiple of them, the chance that one of them may end up being cancerous is very high. There are some diseases that we see in the breast that are precancerous. So you see them that the architecture of the breast tissue have changed. When you take and you look at it under the microscope, you see that it doesn't look right, but it has not turned into cancer yet. Some of them, they have turned into cancer, but it has not moved out of their location yet. So we call those people precancerous. And the two of them is the double carcinoma inside. And that's something that we see a lot. And typically, that's the one that the mammogram is very good in picking up early. And when we take it out, you almost always become cancer-free. Anybody with family history of breast cancer or ovarian cancer is at risk. It doesn't mean that you are going to get cancer, but your risk is higher than the baseline. Anybody who has been previously treated with radiation have some risk. Now, currently, the radiation that we use for imaging in all the modalities, it has significantly lower than when I was in medical school. Those radiations were so high at that time. But now still, the exposure does not go to zero. And then for some time, they used to use some form of, how do you call it? Estrogen, because diacylglycerol, that it doesn't exist anymore. But those who were exposed in the 40s to the 70s had increase of breast cancer. It doesn't, we don't use them anymore. So nowadays, we are not seeing it as much as it used to be seen in the past. Now, what are the things that you can do something about? Being physically active is one of them. Obesity, and especially after menopause, is a risk factor. People who have taken some form of hormone after menopause is a risk factor. And like I said, anybody who have the regular undulating period where the hormones go up and down, you have your period, the estrogen keep on down, those people have increase of breast cancer. So anybody who did not get pregnant for a long time, after age 30, anybody who have not breastfed before. Now, the breastfeeding, if you take the baseline, it decreases the risk of the breast cancer. And for whatever reason, when we look at the data, people who have had premature babies apparently have increase of breast cancer. We don't know why, but and alcohol drunk in moderate to severe range can cause breast cancer. It's a risk factor, right? And so the mainstay, all what we are doing this month and all the time is to make sure that we can detect the breast cancer early. And all the public health apparatus, everything that we have, we need to throw it onto the early detection until we get a preventive way of, as a way of preventing it. The mainstay is always going to be detect it early. Whatever it takes for us as a society to detect breast cancer early, we need to do. And it's for all women, regardless of their ability to pay, their race, or their ethnicity. We need to make sure that everybody, every woman who wants it, have access to the ability to have early detection. Why? Because it is the difference between life and death. About 65% of breast cancer cases, when we diagnose them early stage, the 5-year survival rate is over 99%. That means that if you diagnose early 100 women, only one may die within 5 years. And so you cannot emphasize the importance of diagnosis early. And that's why we have three ways of encouraging people to be able to have detect early. The first one is self-breast exam. This used to be the mainstay of actually diagnosis until the screening mammogram became a gold standard. However, still, about 40% of breast cancer which are diagnosed are detected by the women who feel a lump. And therefore, we still encourage women to do regular self-breast exam. Anybody tell you to stop, don't stop. And the reason is that first, you get to know your body, you get to know your breast, how you feel, how the tissue, how it looks. And you are going to be the first one to be identify if there's any change in the shape, the skin color for some of the breast cancer, if there's any nipple discharge. Sometimes it may not be a lump, but you normally would the one who will know that something have changed. And that is what we want you to be able to identify. And the next one is going to be going for clinical breast exam by a healthcare provider. If you go to your annual exam, make sure this is done. Now, how do you do the self-breast exam? And when I was a student, we used to tell women to do it when they have their period. Now we have changed. We do it sometime after the period because the breast tissue is less dense and it's less sore. And you want to make sure like it's something on your calendar. If you are not having periods, choose any time that you want to do it, but just be consistent to do it every month, right? This cannot overemphasize how many times is the woman who felt something and came to tell me and then it tells something else. How many times I'm seeing a lot of women who are actually breastfeeding. It will come, something it's like a lump. Normally we think it's okay, this is a milk plug, this may be an abscess. We go and do an ultrasound of it, then you say, hey, it's something more than that. Then it turned out to be cancer, right? And so I just want to make sure that women listening to me understand you don't stop, get to know your breast very well, know the tissue, how it feels, know the skin, look at the nipple, so that when there's a change in it, you'll be the first one to notice it and let some healthcare provider know. And obviously, the screening mammogram over the past 25 years has become a game changer. It has been able to allow us to diagnose most of the cancers at a very early stage. And with the treatment options available, we are able to treat it without people dying. And that's all what we want to do. We want to make sure that wherever we are, we advocate to make sure that a woman, regardless of their ability to pay, their status, their immigration status, whatever it takes, if you live in this country, in our community, she have access to some form of screening mammogram when she needs one. right? And so this is a picture of how the mammogram machine looks, and it's kind of sometimes it hurts, but right now my understanding is that it has become better, and I'll have anybody here who can share their experience through a question. I will be glad to hear it, right? So I want to spend some time to talk about what we call the triple negative breast cancer. So what we do is that after we see a lump on a mammogram, we normally would do a biopsy. We do a biopsy, it's going to tell us that this is benign or this is something cancerous. And then when they say it's cancerous, we're trying to look for lymph nodes, typically towards the armpit, to help us to decide how widespread is the cancer. Now, we always also look at some receptors, some proteins which are on the surface of the cancer cells. And these receptors, they can be either estrogen, progesterone, or human epidermal growth factor receptor. We call it HER2. And these receptors are very important as a target for treatment, for chemotherapy, so that if any of the receptors are there, we can have medications that can target that receptor and go and kill the cancer cells in the body. So if that cancer type does not have any of these receptors, then our hands are tied behind our backs. We don't have treatment for it. Then it's very aggressive. It's very, very aggressive type of cancer because we don't actually have ways of actually to manage it well, right? And why is this important? It accounts for about 10 to 20% of all the breast cancers. We see it in younger women under 50, and it's very common among women of color, our women. We don't know why yet. There are a lot of theories behind it, but we don't know, none of them is conclusive. All what we know is that it's very aggressive. It's people who are younger and younger. In this area, I remember when I was working for the health department, we have a special area in the parish area. We have a cluster of women who have been diagnosed over there, right? And so it spreads quickly and have a lot of recurrence, and it doesn't respond to hormone therapy. That's why I have a special focus, a lot of research going on to better understand its behavior and how we can prevent it or better treat it or diagnose it a little bit earlier. We are looking at other immunomodulators, like how we can maybe modulate the immune system to maybe recognize it so that we can use that as a target for treatment. Now, these are some of the local resources that we have available. Almost all the health departments have breast cancer and cervical cancer early detection programs. Sarasota County, DeSoto, they are almost all the counties have it. And I'm providing you the number to Sarasota. Sarasota Memorial Hospital also have a program that, previously until last year or so, the Florida Department of Health was doing only for women over 50, and Sarasota Memorial was doing only between 40 and 50. But now the recommendation has been brought down, so they are all doing it. And it's a screen mammogram. That means that we don't know, you have a lump, we don't know what it is, and you want to have a mammogram. And so I just put a number there for the Sarasota Department of Health, and this is for Sarasota Memorial. So what can you do? So we want you to be a self-advocate. You advocate for your family and also advocate for yourself. Talk to your healthcare provider about your individual risk. Ask them, after they get your history, ask them whether you have any increased risk. Ask them at what age and what frequency should you have mammogram. Some people with family history of breast cancer of first degree relatives, we recommend they have it actually 10 years younger, right? If they make any recommendation for mammogram screening, make sure that is done. If you are having any barriers, reach out. Don't sit on it. Don't get frustrated with the system. Yes, sometimes our healthcare system can be a pain in the behind, but when these things are so life-saving, that go every step possible to make sure that you can get it done. And sometimes, based on your initial mammogram result, we may recommend additional screening. For example, some women may go, they may see like a lump, we may have to do ultrasound. Sometimes when we have dense breast tissue, we do what we call stereotactic MRI. That actually gives us a better view to be able to see. When those things are recommended, let's follow it up. Let's be aggressive. Let's advocate for ourselves. Like I said, talk to somebody. There's always somebody who can help you navigate the system. Yes, it may take a little bit of time, but these things are available in our communities, and we should be able to get it done, because this is the only way we are going to help prevent death, right? How do you lower your risk? Achieving and maintaining healthy weight is always good. Keep yourself physically active. Limit alcohol intake. If you are a woman and you have the opportunity to breastfeed, take advantage of that. Apparently, it helps. Smoking or vaping never helps with most of the cancers, and breast cancer is one of them. So take steps to be able to quit smoking. Right now, I just wanted to have some fun here with breast cancer myths. Right, one, a breast injury can cause breast cancer. I've heard it several times before, and with the bra, can the bra cause breast cancer? We do not have any evidence of injury cause breast cancer. However, there are some data in some women who have not had mammograms. They had a breast injury. As we are treating it, we uncover breast cancer. So not necessarily the injury caused the cancer, but the injury led to the diagnosis. So I just wanted to let people know. Breast cancer is more common in women with bigger breasts. It does not, people with bigger breasts don't have more breast cancer. The problem we have is that we diagnose them late. There's challenge in diagnosis because a lot of time when they do their self-breast exam, they don't feel it early. And sometimes the mammogram may not pick it up early. And so we end up diagnosis late. And so when they get diagnosed, it's at a later stage, and then they end up having a worse prognosis, right? The next one is finding a lump in your breast means you have breast cancer. The answer is no, 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 no. Only 10 to 15% of the lumps that we actually found end up being breast cancer. The majority are benign. And so when you have a lump found, that doesn't necessarily mean that you have breast cancer. You need a follow-up. It may need to be biopsied, but it doesn't mean that you have breast cancer. Breast cancer can only affect middle-aged or older women. I know I mentioned that's not the case. Increasingly, we are seeing more and more women under 50 getting breast cancer, and it's almost always surprise. Almost always they must have the woman feed a lump. He talked to a healthcare provider who dragged their feet. They didn't want to order the imaging to look at it. They watch, and then somebody say, okay, let's go ahead and do a biopsy. Then it turned out to be breast cancer. So we are becoming more aware of this, and we are becoming more aggressive in ordering this imaging so that we can diagnose early. Like I said, we have been seeing some few women during pregnancy and the breastfeeding stage having breast cancers. The next one, men do not get breast cancer. We talk about it. Men get it. It's rare, but they get it. And when they get it, if they are not careful, they are most likely to die from it because it's diagnosed very, very late because nobody think about it. Carrying a phone in your bra can cause breast cancer. Up to now, there is no data that show that a phone vibrations cause breast cancer. What we have seen is that there have been some women who, I don't know if that place is the best place to carry your phone, but people do. And some few people have been burned over there by their phones. And sometimes when you go there to reconstruct the breast, we end up seeing there is a cancer, some underlying cancer over there that we didn't know. But we cannot say that it was the phone which was only called a cancer, right? The next one is wearing bra with underwire can cause breast cancer. The answer is that we don't have any evidence of that. There have been suggesting that when you have the wire, it may cause backflow of limbs and it can trigger inflammation that may cause cancer. We don't have any evidence of that. And we just want to make sure that when women they choose the bra, they choose the appropriate size. If it's too tight, sometimes it can cause fluid blockage. And so there's a lot of activity going on with the breast cancer awareness program. Several trying of breast is going on around the country right now. If you can participate in that, that is great. But know that neither the bra itself or the wire under it has been shown to cause any breast cancer. And then mammogram can cause breast cancer or spread it. We have done about 10 billion mammograms across the world. We have a robust data. There is no evidence that mammogram itself ever causes breast cancer. And if the gene mutation BRCA1, BRCA2 is detected in your DNA, you will definitely develop breast cancer. The answer is no. You have a high risk of breast cancer. It's up to about 50% by age 50, but it's not a condemn that you are going to have breast cancer. A lot of women, when they get this diagnosis after they have their case, they don't want to wait until age 50, 70 to be told that they have breast cancer. A lot of them go ahead and do prophylactic mastectomies, remove the breast, and so that they don't develop it. And you may have heard some people in the news like Angelina Jolie and co, right? And the final one is this, my favorite one. And the men were also asking me, sucking on breast, can it cause breast cancer or prevent breast cancer? We don't have any evidence of that. The only thing we know is breastfeeding leading to lower incidence of breast cancer in breastfed women. But adult sucking breast, there's no evidence of either way, right? So I'm going to end here and take some questions. I have some more slides, but I want this to be a little bit more interactive. So I'm going to stop and then make people ask questions. Thank you very much. Back to you, Dr. Merritt.
Dr.Addae, that was fantastic, so informative, and we will make the slides available if that's okay with you on our
Absolutely.
resource page. We have a Know Your Body section, and we will update that as well. I think that this was so important that you talked about all the positive progress that's been made because of good research and funding and supporting good research, right?
Yep.
And at the same time, we do have situations and we have clusters in this area. Some of our beloved former MHI leaders that I bring to mind, Bettina Tyler, Yvette Robeson, unfortunately their lives were cut short by breast cancer. And we have many clusters of younger families and women, and that's why we're really encouraging the self-examination. And one of the things, I don't know if you've ever talked with your patients, but we've talked about in our support groups and everything, was about creating a breast map. So women draw a little diagram for themselves, and when they examine themselves and they feel little lumps wherever they usually are, they draw that on their map. So each month they can remember, because if people, like I have fibrocystic breasts, and those get a little tricky because there's a lot of lumps there, but they're not always bad lumps. And you get 1 or 2 mammograms, you realize that that's just how your breasts are. So could you talk a little bit about topography?
Yeah, so talk about
And
topography.
then I don't know if Nina,
What should we be doing?
Yep,
I don't know if Nina, Monique have any questions to share as well from the audience.
Yeah, we talk about topography, especially those who have been diagnosed with that fibrocystic breast disease, and those who have had multiple mammograms where a lump is known to be located in a place. Sometimes they go there and the provider doesn't find it anymore, or maybe after 1 or 2 cycles, they don't find it anymore. So we do the topography actually. But for the message is that, especially for the first finding of a lump in your breast, you are going to see a provider and you're going to need some imaging. Like I've had several times that a woman come to me and say, you found a lump here, and then we cannot find it. I go ahead and order a mammogram. And lo and behold, about 90% of the time, they will find something. So the woman knows their body far, far, far more than anybody else will ever be able to know.
I think it's also important to speak to the concerns. I know we've done other screening programs, and we used to have tea parties, and we used to train. Our navigators have done such a great job. One of the things that came up was women didn't want to check themselves because they didn't know what they would do if they found something out. So it's very reassuring to know that the breast and cervical cancer program is going, that there's funding that will help get the screening and also to get the care that they need, correct? That even if they maybe don't have insurance or they don't have good insurance, that there's going to be a way that they're going to get taken care of. And that's why it's worth it to find it early, where it's less complicated and it's tiny, and you get a better outcome, right?
Yep. To the best of my knowledge, every single county, every single federally qualified entity in the counties that outsource these programs, they all have breast cancer and cervical cancer screening programs that you don't have to pay anything. And in these counties around here, especially our 8 counties around our area here, it's so robust. We do it together, we collect the data together, and I'm always available to talk to anybody. If you need a mammogram, if you need a pap smear, we should be able to get you one in any of these countries around here.
Thank you. So Mia, have any other questions come in, or do you have any questions for Dr. Addae and even Dr. Hill?
And no, we haven't gotten any questions, and I don't have any questions.
Okay. So on the Facebook stream, is there any way for us to see if people are commenting or anything, or? Not sure how I look at that on this thing.
While you're taking a pause, I just want to say that was an excellent presentation. Certainly it's one that our women of color need to hear. And Dr. Addae, you brought out all the very important parts. One that sticks in my mind is that the incidence is higher in white women.
Yep.
But the deaths are higher in Black women. And that's what you and I and Dr. Merritt are trying to do, and that is to decrease those deaths. A recent report came out this week that said the earlier that a woman gets her mammograms, more likely she will stick with it and have an early diagnosis. So our problem is really early diagnosis, forgetting to get the mammogram scheduled. Family matters come up. Life happens. Someone in the family gets sick. Somebody in the family dies. And you skip that mammogram. I've had it in my own family. So the important thing is, women, please think of yourself sometimes first and get that mammogram. And as you said, you can get a mammogram at any of the healthcare facilities, or you can get one ordered at those. And then another thing is, as you know, you both know, we have a mammogram bus that the Cancer Center at SMH helps us bring down from, I think, Tampa. And those mammograms are free. So that there's no reason why a woman cannot get a mammogram. Even the American Cancer Society has an opportunity for women to have a free mammogram. Very good.
Yeah, it's very good. And I will say it is not a fun thing to go through. Okay.
Yep.
We don't look forward to having our mammogram. But on the other hand, the relief of knowing that you're clear again for another year, and also if something is found and you've been doing it regularly, to know that it's been caught early and it'd be easily dealt with. I mean, did you say it was 99% for early detected lesions? We have a 99% cure rate. I mean, that's unbelievable. So it's really worth it to think about that moment's discomfort for the trade-off of how much better you will be if you don't get really, really sick and don't have all of the other complications that could happen. I think it's also important to talk about environmental factors, and that may be part of what contributes to some of our clusters, especially in early family presentation as well as genetic predisposition. And the more that we can really, oh, I'm sorry, Monique, there you go. Hi. You had a question or comment?
Oh, yes. I was wondering, Dr. Addae, when you talk about younger, I see that you're mentioning 50 and younger. What have you seen, I guess, your youngest patient being affected by breast cancer, or maybe having found, because my mom has had, what do you call it? Basically, it's not a sty, but the benign, like tissue or dense breast tissue that they've put a marker in. So what's the earliest age that you found dealing with a patient with like an early indicator like that?
Yeah, in Sarasota here, 29. Pregnant
29.
woman, 28 weeks, he come in for an exam, say still a lump. And then he had complained about it a month earlier, it wasn't bigger. We ended up sending her for mammogram and did an ultrasound, did a biopsy, and then it came up with cancer. We
Wow.
have to deliver her earlier. Now, anybody who has seen me in the hospital, the youngest patient I've seen in this country was actually my co-resident. Anybody who has seen me, I'm always wearing this pink thing in my career, and that's why. We're in the clinic together, found something in her own breast, and she have the other resident feel it, and they wanted us to order a mammogram, and we ordered it, and it turned out to be cancer, and she was 26, second-year resident.
Wow.
Yeah, we've had several in the cohort here in Sarasota in their 20s, in their mid to late 20s. So it's why
So I
it's
don't,
important to know your family history as well as just start early. And every month, just do the check, make it part of your routine. What time of the cycle would you say is a better time, Dr. Addae, for women to
typically,
do their self-exam?
like as I've mentioned, when I was a student, it's like when you are at the tail end of your period. Now we go to like a week after the period around that time. The breast is less dense and less sensitive, so most women are able to do it at that time. If you are
Right.
a woman who is not having a period, then mark somewhere consistently every month. You do it around the same time.
Yeah, like the first of every month, just make it
Yes,
be a
every
routine.
month, the middle of every month, the 3rd, the 21st day, like just mark on the calendar. That's when we are going to do it. Yeah.
And it's nice to just make it part of your routine in the shower. That's an easy time, a good time to do the exam because, the first part of the exam is you take off all your clothes and you look. You lean forward and you see if there's any dimpling, anything abnormal. You raise your arms up over your head. Again, you look for anything different. Then you're in the shower and then you just feel around in a circle, with your hands flat and you just do each breast. And remember to go all the way up into your armpits, all the way up, because that's where the lymph tissue can go in there. And the soap helps you to slide over into, gentle pressure to really just poop, 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 it's done. And then you know what's going on. I think it's really, really important that we bring that home. And I hope that people will come. Could you tell us again those dates and times for the Links event?
It's not this weekend, it's next weekend, because we're gonna do the column on it again. And it's next weekend, next Saturday at Dillard's. And I want to say it starts at 10. The information is in the in Temple this week, and there's a parking lot number 7, which is out by Dillard's. Evidently, what's going to happen is their lingerie department is going to open up early and allow women to come in and get fitted for a bra. Young women, make sure they're at the right size bra, and then Kathy Jenkins will be talking about breast cancer.
Well, that seems like that's about the 18th of October.
Yeah, it's a
Perhaps.
week from Saturday. I don't have my
Sounds
calendar,
about right.
but
Yeah, I'm looking at it. So that's that looks like the 18th of October. Great news. That's
right. It's
good
it's
to
put
know.
on by the Links, and the Link ladies are always looking for ways to help with health.
Exactly. Well, we thank everyone. If there aren't any more questions or any more posts, remember that you can always email us at info@v-mhi.org. You can go to our website, which is www.v-mhi.org. And you can also give us a call at 941-225-8198 if you have more questions. On our website, we have a lot of information. And our newsletter this month and the reminder for this event has some great links on local resources. We have a breast navigator right at Sarasota Memorial that will help you. We also have one at Manatee Memorial, and we have MCR Health, as well as a variety of other locations where people can get care, no questions asked, and people are there to help you and to reassure you and guide you through the process because we want everyone to be well. And I want to make one last point. When we did our trainings and our tea parties, about 10% of the lumps that were found by the partners, found by the men, the husbands. And so we include you in. And if you find something in your partner or your husband or partner brings something up and says, hey, what is this thing?
Exactly.
You got to act on it and let them help you and make sure that, it's a team effort here and that's still valid. Maybe they can feel something different from, their perception and it's worth taking into consideration.
So I
want to thank Mia and Monique, for your good work and helping to put this together. And I want you to look forward to more messages from them. I'm going to put together more educational information, that's our emphasis right now with MHI. If you like this, we hope you'll continue to support us. We welcome and thank everyone for your support. It's required for us to kind of keep going with all these changing times and a lot of the grants and things that have been cut. But our ladies, Angie, Darlene, and Bonnie, continue their work in the community doing educational programs. So do look for that and do join some when you can. So at this point, I guess we'll say good night.